Well, all week, we're asking your questions about the coronavirus pandemic to local doctors and healthcare professionals. All you have to do to ask your question is text it to us at 479-785-5055. This afternoon, we're joined by Baptist Health nurse practitioner Nycole Oliver. Nycole has been on the front lines testing and swabbing patients. She's going to be answering your questions today about COVID-19. Nycole, thanks for being here.
Thank you for having me.
All right, let's start with something that I know that we've talked about before with other healthcare providers, but I think it bears repeating. What are the telltale signs and symptoms of COVID-19?
So the telltale signs and symptoms right now are fever, a dry cough, and shortness of breath. Those are the three main ones.
And that is for adults, correct? Have you seen any difference of symptoms in children at this point?
Not at this point, we haven't.
Okay. And are there people that are presenting with other symptoms besides those main three ones?
Yes, sometimes people are presenting with stomach issues, like they'll have diarrhea or nausea or something like that.
Okay. What are you telling patients who suspect they may have COVID-19?
So we're telling them not to flood the emergency departments or their doctor's offices if they think they have symptoms. We in the River Valley have a hotline in our community that they can call. And the number for that is 479-289-6508. And they can call that number and they will be screened. They will have their questions about COVID-19 answered, and they can be screened to see if they need to be tested for it.
Gotcha. All right. This time of year, we're also dealing with allergies. It's also still flu season. So what are some of the major differences in symptoms between all of those illnesses and COVID-19?
So with allergies, a lot of times you're not going to have a fever, although you can have a low grade sometimes with allergies. Also with allergies, people will have a runny nose. Sometimes they will have kind of a more wet cough. And with the flu, they may have a really high fever. They may have a wet cough. Sometimes they will have stomach issues also, but they have severe body aches and fatigue and things like that.
I know sometimes it can be difficult to discern the difference in symptoms, and I'm assuming that's why those screening hotlines are so important, so that a medical professional can ask questions about those symptoms and then make that differentiation and determination.
Yes, absolutely. And when people are calling the screening hotline, we're trying to help them differentiate if they have those other like allergies or the flu or whatever. We are having them usually be screened for that at their primary care physician's office. And if those tests are negative and then they still fit the criteria to be tested for COVID-19, then they come to the testing place.
Okay. Larry has asked, and we've heard this question from a lot of people, once a person gets over coronavirus, can they contract it again?
I don't think that that's a good question to answer at this point because this is a newer virus, a newer strain of the virus, and so I don't think they've really done a whole lot of research on it yet. I personally have not heard of anybody recontracting it after they have had it and recovered in the first place.
Okay. I know that you're on the front lines, you're out there testing patients. Can you explain to us what a typical day has been like for you, and what the testing process is like for people that you actually are interacting with?
So usually people, of course, will call the hotline. And so when the testing tent opens up, I'm usually one of the very first points of contact because they are screened over the phone. And so then they come through, and as a nurse practitioner, I will screen them again to make sure that they have the symptoms and that they have travel history or they've been in contact with somebody who has had the virus. So they will drive through and they will talk to me and we'll take their temperature. They, of course, have to have an appointment. And then if I deem that they need to be tested, then they go through the drive-through testing tent where a group of healthcare professionals, nurses, are meeting them there, and then they are swabbing them, and it's a nasal swab. So they are not even getting out of their vehicle, and they are swabbing them, and then they are sending all of that stuff off to the lab to be tested.
How have your interactions been with patients? How are people reacting when they come in and they're getting screened and potentially tested for this virus?
Some people are very scared, understandably, and so we try to reassure them as much as we can. Some of them have been to Walmart before they come to get tested, or they have been other places, or they bring their whole family. And so that kind of stuff, it's just educating them to, don't go to Walmart. If you have pass through the screening hotline and they think that you need to be tested and you come through, don't stop by anywhere. Don't go to work. You need to self-quarantine for 14 days, but you need to come get tested, and then we'll call them with their test results. But until those results come back, people need to quarantine themselves, and they certainly don't need to bring their family of 6 to the testing site with them.
Gotcha. Talk a little bit about the personal protective equipment that we've heard the governor and healthcare leaders in the state talking about. What are you guys using on the front lines to protect yourself?
So we're using an N95 mask, which is recommended by the CDC if you come into contact with somebody, into close contact. So we're using the N95 mask. I personally am putting another simple mask, surgical mask over that. And then we're using a face shield and a gown, and usually people are using shoe covers and hair covers as well.
Gotcha. Thank you so much for giving us that insight. We'll have many more questions from viewers headed your way after the commercial break, so please stay with us. If you want to ask questions to nurse practitioner Nycole Oliver, you can send them to us by texting us at 479-785-5055. That'll be coming up after this break. We are joined again this afternoon by Baptist Health nurse practitioner Nycole Oliver. We are answering your questions. A number of you have texted in those questions to our hotline, 479-785-5055. Nycole, we want to get to a question from Courtney here. Her question for you is, after exposure, how long before symptoms can first appear?
Typically, it's 2 to 14 days.
Can you be a little bit more specific on that? Or is there a difference between people who are seeing symptoms pretty immediately versus someone that may not get symptoms for 2 weeks?
It's been different for everybody, and I think it depends on the individual person and their comorbidities and different things that they have.
Okay, so but just because you haven't seen symptoms until that 14-day window doesn't mean that it will be any less severe if you do end up getting the virus?
Not necessarily.
Okay. Another question we have for you is fever. Fever was one of the symptoms you mentioned of COVID-19. Is a fever always present with the COVID virus?
Not always. That's just one of the cardinal symptoms, and it's one of the things that we look out for, fever above 100.4.
And something that you can kind of, your body's letting you know that something's wrong, right?
Yes, yes.
If you're exposed to the virus, will you definitely get COVID-19?
No, you won't definitely get it if you're exposed to it.
But people that have been exposed to someone who is tested positive are still being asked to self-quarantine to kind of monitor their symptoms, correct?
Yes, for sure.
Why is that so important?
It's just important because you can actually have the virus and not exhibit symptoms, and then you can pass it on to other people while you are not having symptoms. And so that's why we ask people to stop the spread, and that's why we're asking people to do social distancing as well, so that we can just try to stop the spread of the virus.
And to be clear, right now, people cannot get tested for COVID-19 unless they are symptomatic, correct? So there could be people who are sick that just don't know it because they don't have a test to take.
Yes.
Okay. Candy's asking this afternoon, how long does it take for the virus to go away if you get it, and does it always need hospital care?
It does not always need hospital care. Usually the younger, healthier people that don't have a lot of other like viruses and other diseases, they typically don't manifest really bad symptoms that are going to require hospitalization. Usually it's going to be different for everybody on how long does it take for the virus to go away, because it again depends on age, comorbidities, different things like that, and how good your immune system is.
Okay. After someone gets COVID-19, do they have any sort of immunity from it from then on? Is that something that you guys have been able to see any research on?
I have not seen any research on it yet.
Okay. Hopefully that's something that we can learn as this disease progresses and we get more information and studies done on it. Well, thank you so much for answering those viewer questions. We'll have a lot more coming up after this break, so make sure you stay with us. Back now this afternoon with Baptist Health nurse practitioner Nycole Oliver. She has been on the front lines testing and swabbing patients for COVID-19, and we are answering your questions today. So Nycole, I'd like to start this round of questions with talking about the peak of coronavirus. We hear about the flattening of the curve and the curve up of cases. What are the projections for that peak here in Arkansas, and do you feel like the healthcare sector is prepared for that?
Today, I heard that the peak is going to be about 6 to 8 weeks, but that is going to be a question that's better answered as we get test results back and all of that.
I know that we have talked about and heard the governor talk about the limitations in testing and the lack of testing supplies. Where is that a concern for you on the front lines? And do you feel like the number of tests that you're able to do give you kind of a projection of what the state is facing, or do you need more tests?
I feel like we probably do need more tests, and that is why we're having the screening hotline, and that's why I'm out at the tent re-screening people so that we can make sure, because I'm not trying to turn anybody away. I would like everybody to get tested if we had enough tests. If you wanted to test, I would like everybody to be able to get tested, but that's just not possible right now. And so that's why we're screening these people and trying to do tests on people that actually have symptoms that are at the highest risk of getting this virus so that we can make sure that we take care of those people.
We did get this question texted in to us, and we've talked a little bit about this. How long can the virus last on different surfaces like glass or cloth or even other shared surfaces?
I have seen different research on that, so I would really rather not give an answer for that question specifically, just because there's a lot of different research with different numbers out there, and I don't want to give you a wrong number.
Sure. Why, though, is it so important to do the hand washing and to use hand sanitizer and clean surfaces? Can you elaborate on that?
Yes, it is very important because I think that at this point, they don't know exactly how long it lasts on certain surfaces. So that's why they are trying to make sure that everybody is doing everything as clean as humanly possible.
Gotcha. We just got this message sent to us. After being tested for COVID-19, what is the average wait time to receive test results?
I would say about 5 to 7 days. That's the average that I have personally seen so far.
And in that time, you are sending people home to self-quarantine while they wait for those results. Is that right?
Absolutely, yes.
Okay. How equipped are the hospitals with ventilators?
With ventilators, I feel like we have ventilators right now, but if the peak is indeed going to be 6 to 8 weeks, we are really going to not have enough. And so they are taking measures. The governor suggested and the president has suggested that we cancel elective surgeries and different things like that. So the hospitals are doing everything that they can to prepare in case the peak is in 6 to 8 weeks so that we do have enough ventilators and not doing all these elective procedures that could take ventilators away.
Sure. We got this question from Maggie. She's asking, if you typically have upper respiratory problems, does the coronavirus last longer?
Not necessarily.
Sorry, I didn't hear your answer. Can you repeat that for me?
Oh, not necessarily.
Okay, good to know. And let's just ask one final question. We were being told if you have only one of those symptoms, right? We mentioned fever, shortness of breath, a cough. Someone saying if they only have one symptom, should they isolate? Do you have to have all three of those symptoms to potentially have the virus?
You don't necessarily have to have all three, but you're more likely to be tested and go through the screening and everything if you do have all three. If you just have one of those symptoms, it's not necessarily a reason to be tested. And honestly, you probably won't pass the screening to be able to be tested at this point.
Sure. Well, thank you for answering those questions. We're going to leave you with your final thought after this break. Thanks for staying with us. Welcome back into your 5 News at 5. Throughout the COVID-19 pandemic, we've been welcoming medical professionals to answer your questions about the coronavirus. If you have a question you'd like answered, you can text it to the number on your screen. That's 479-785-5055. This afternoon, we're joined by Dr. Abby Baldwin. She was with MANA here in Northwest Arkansas. Doctor, thanks for being with us this afternoon.
Thank you for having me.
So first, let's start with what do you do in your daily practice and what has changed with this pandemic?
My daily practice is a family medicine clinic on college, and quite a bit has changed in the last couple weeks. Fortunately, we have been preparing much longer than that for this to happen, just in case. But now that things are escalating with case numbers, we have shut down our practice and are doing only telemedicine visits. So for the first time, I'm at home seeing patients at my computer. But so far it's going pretty well and it's keeping people safe.
Our first viewer question this afternoon comes from David. He's asking, can you contract the virus through airborne or actual physical contact or both?
You actually can contact it from both. The primary way airborne can happen is if you're actively around someone who is coughing and sneezing. So that coughing and sneezing would create droplets that you could potentially inhale. So that's the idea, that everyone keeps emphasizing the 6-foot distance between others so that you don't inhale those droplets and get sick.
Once someone has recovered from COVID-19, we've heard of 12 cases here in the state so far, and hopefully those numbers will continue to grow. Can someone who's recovered get it again?
That's actually a difficult question to answer. Technically, no, they cannot. There have been some conflicting evidence coming out of China that there were some positive cases after people had been discharged from the hospital. But what we believe is that the result of that is because of possible false positive test results after they leave the hospital. So with any test, whether it's a flu test or COVID-19 test, you can have a false positive test, which means that you don't actually still have active virus in your system that's causing a problem. So
Gotcha.
That's what we believe is the cause of that. Technically, you should not be able to get it again once you've had it.
We've talked a lot about, obviously, hand washing procedures and using hand sanitizer if you can't wash your hands properly because of the risk of the virus being on something that you touch. How long can the virus live on those inanimate objects?
That's a great question. It depends on the surface type. So if it's a plastic surface, it can last for 2 to 3 days. Cardboard surfaces can last for 24 hours. And they found that copper surfaces are actually 4 hours. So that's the least amount of time. So that tells you it's very critical to wipe down surfaces regularly.
From Myra, she's asking this afternoon, just wondering if we should wear a mask or gloves when we go out. What would your response to that be?
From my opinion, if you're considering wearing a mask or gloves to go out, you should probably reconsider what you're planning to do. I think that indicates you have concern that you may be around close contact with people, and so you need to reconsider what your plans are. And if you do have to go out, say you need to get groceries and it's a necessary outing, then say if you do have severe health conditions that put you higher risk, it wouldn't be a bad idea to consider wearing gloves.
We have heard, though, that if you don't clean your hands properly, that those gloves can be just as dirty as not washing your hands. Is that right?
Yeah. Especially if you're touching your face.
Gotcha. Okay. Tell us a little bit. Obviously, you said that you've been doing telemedicine with patients. What are some of the most asked questions that you have gotten from those people that you are video conferencing with about COVID-19?
Most people want to know an end date, and I wish I had that answer at this point. No one does, but that's the most common question I get. And another common question is, how do I stay safe? How many measures are you taking with your own family to keep yourself safe? So I feel like they want that guidance of what is socially acceptable, but also that you need to do to take those precautions. So I think it is helpful to hear that from their doctor.
Absolutely. Well, thank you for answering those questions. We'll have more viewer questions for you coming up here after this short break. Stay with us. We are back now with Dr. Abby Baldwin. She was with MANA here in Northwest Arkansas in family practice. We're taking your questions about COVID-19 this afternoon. We have a number of viewer questions we'd like to get to right now. Doctor, first, if you could answer for us, we have viewers that would like to know if mosquitoes can transmit the COVID-19 virus.
There is no evidence to support that mosquitoes can transmit the virus.
That is definitely good news. Could that change as we get more information about the virus?
I don't think so.
Okay.
This is not a typical viral illness that mosquitoes can transmit. So I don't think we have to worry about that.
But the transmission at this point is coming from human to human contact?
Yes.
Okay. We have a specific question about a scenario that someone has asked. She says, my daughter has run a low-grade fever for about 36 hours straight now, but does not have any other symptoms. Is this something I should worry about?
Well, obviously, as a parent, you should be concerned. I would be concerned as well if it was my daughter that had those symptoms. However, the the good news is that could represent many other types of illnesses other than COVID-19. So the most important thing would be to watch for other symptoms developing, make sure you continue supportive care, rest, fluids, and then reaching out to your primary care doctor. If there's a concern, call the primary care doctor and get an appointment. We're, offering telemedicine appointments, so that's something that could easily be checked up on.
Another question in the realm of children, how does COVID-19 affect pregnant women, and how could it impact the baby in the womb?
Well, in pregnant women, most cases are mild to moderate with symptoms. The good news is they have not found a link of transferring the COVID-19 to the fetus. So while mom can be affected, the baby would not be affected during pregnancy. So that's great. The most important thing during pregnancy is to try to stay well. If a mom did end up getting sick, again, continuing supportive care, more than likely they would get through it. But the key is trying to self-isolate so that they don't get sick in the first place.
Gotcha. I want to move on to this question now from Billy asking, have you heard of any of patients who have lost their sense of smell or taste, and did they get it back after they survived the virus?
In the cases that I have evaluated so far, I have not heard that personally. However, I have heard news reports of that happening in other countries. From that group of symptoms, the loss of smell and loss of taste, it's hard to designate as a true objective finding that we can use to mitigate how people are going to be treated, because so many other things can cause that as well. So as a group within Northwest Arkansas, we have chosen to focus on fever, cough, and shortness of breath as the main 3 symptoms to look for. So we don't use that as a guiding force of we're going to, test this person versus this person, but it is good, helpful information to know.
All right. Thank you for your answers there. We'll leave you with a final thought after this break.